Maayong adlaw, Negros kag Bacolod. Yari naman kami para magadulong sa inyo sa mga nagakinatabo diri sa CLMMRH kag sa isla sang Negros. Diri lamang sa The CLMMRH Insider. Sa sininga semana, amon ipakita ang sitwasyon sa amon emergency room sa sininga tiempo. Bilang nagaisahan nga government referral center sa syudad, ginatinguaan sa CLMMRH nga maserbisyohan ang amon mga pasyente. Pero tungod sa kadamuon sa mga kaso sang COVID, naglabot gid ang amon emergency room sa full capacity. Pila ayan ka mga referrals ang mabaton sa emergency room kada adlaw kag diin ini sila laban nagahalin. Kamusta man ang kondisyon sa mga pasyente nga amon ginabaton?
In this time of the month, we are experiencing a surge of COVID-19 referrals with mostly critical and also we cater moderate to severe cases. All throughout Negros, we are experiencing a surge of COVID-19 cases and most of it are referred to our institution. To address this, we are having line list of referrals so that we can prioritize those who need help. The status of these referrals mostly are critical patients who need advanced care, advanced airway care. Mostly, our institution are able to provide. In this line also, we are doing our best to serve the most patients with the resources that are available with us.
Currently, if we focus on COVID cases, since we started some surge this year, especially sa note na we have the Delta variant sa Bacolod and Negros, more than 70 to 80% of walk-in patients are COVID severe and almost 100% na some transferred cases from other facilities like district hospitals natin are having severe critical COVID. If we compare the census before the pandemic from the average of 5,000 a month, so that's around 100 plus per day. During the start of the pandemic, we received less than half of the cases na lang. But please take note that we need to decrease the number of beds to address the necessary infectious prevention and control protocols so we can avoid infection both sa patients na gina-receive natin and sa staff. That is also the main reason that we wanted the transfers and referrals are coordinated well. Because before mag-abot ang patient na ipatransfer, we are checking if we have still available mechanical ventilators aside from the ED beds so that we can appropriately accommodate the patient. Remember that most cases, emergency department na already provides critical care. In short, ang set-up natin daw ICU naman. Because sa kalala, sa cases ng COVID, kakalabot sa aton. Referrals mostly comes from Bacolod City, either through DRMMO or ERC. We are also receive referrals from home. But outside of Bacolod, we receive mostly from Talisay, Sulay, Cadiz, Bago, Sagay, and Kabangkalan. Mostly these are from the respective district hospitals, except for Talisay and Bago City Hospital. Since in Talisay, we receive from Talisay CHO. I hope that this interview, the public will have an insight ano ang extent sa kadamo or kalala sa COVID cases that we are taking care of in the emergency department. The surge started last week of August and we are not still seeing that the numbers are decreasing.
Tungod sa kadamuon sa mga pasyente nga amon ginabaton sa emergency room, nagdangat sa 110% ang amon bed capacity. Kamusta man ang status ng amon mga hospital staff kag supplies tungod sini?
So from the very start, the administration was able to provide us with all the necessary protective equipment to ensure the safety of everyone, especially that of our foot soldiers, our emergency department frontliners. There are also times, especially 2 weeks ago, when the new surge of patient came, we almost ran out of oxygen tank. But despite all of that, the administration was able to provide us with the necessary supplies so that we can continue our operations smoothly. As for our bed status, from SARI 1, our confirmed cases are being transferred to SARI 2, which can cater from 10 to 17 patients at one time. But still, despite expanding our bed capacity, there are also times wherein we were able to reach more than the available bed capacity for our confirmed cases.
Ano bala kabudlay ang 8 ka oras nga duty sang isa ka emergency room nurse sa sininga surge?
First time ko nagsulod sa Sari area, kay horror. Yeah, you can never imagine, makita mo back-to-back intubation, ang iban, ilang ma-arrest. So I guess, being a head nurse and also a Sari nurse na dira mo witness kung ano ang kamandag sa COVID-19. COVID-19 is no joke.
Bago kita magtako, ang CLMMRH nagabaton lamang sa subong sang extreme emergency cases. Para hindi mabudlayan ang ating mga pasyente, yari ang mga hospital hotline para sa coordinated transfers. Para sa mga nagakalatabo diri sa CLMMRH, like and follow us sa Facebook ug Instagram. Mga kasimanwa, padayon kita nga maghalong kag mag-obserbar sa mga health protocol ilibay na gid sa subong nga tiempo. Kita liwat sa masunod nga episode. Sa liwat, buligi kami sa gihapon nga maserbisyohan namon kamo sang maayo. Ini si Lyn D para sa the CLMMRH Insider by Horizon.